Hello, welcome to my MyoSpot's Allergy Awareness presentation. I'm going to cover the basics of allergies as they relate to myofunctional therapy, give you some things to think about, and offer suggestions if you believe allergies may be affecting your health. Allergies are one of the most common issues I see in my myofunctional therapy practice, and when clients are able to eliminate them or at least reduce their effects, the results can be quite impactful. So let's jump right in. Just a quick disclaimer, I am providing this allergy awareness topic for informational purposes only. If you suspect you have allergies, you should consult with your medical doctor for diagnosis and treatment. Allergies can have a significant effect on the body. The most common symptoms are a runny nose or sneezing, pain or tenderness around the cheeks, eyes, or forehead. These are all sinus areas. Coughing, wheezing, or breathlessness, itchy skin or a raised rash like hives, diarrhea, feeling or being sick, swollen eyes, lips, mouth, or throat. And these would indicate a possible anaphylactic reaction. Today we aren't going to be focusing on anaphylactic reactions, but if you or your child has this type of allergy or reaction, make sure you address this with your medical doctor, and if needed, keep an EpiPen or similar medication on hand for emergencies. So let's talk about how common allergies are. More than a quarter of the population in the US has some type of allergy. Allergies are the sixth leading cause of chronic illness in the US, with an annual cost of over $18 billion. If allergies aren't treated, they can lead to a number of things, including chronic congestion, asthma, mouth breathing, increased inflammation, poor sleep, fatigue, weakened immune system, and opportunistic infections. So if you're dealing with any of these issues, the one that stands out to me is mouth breathing, which is why you might be doing myofunctional therapy. Pay attention today. Maybe you'll identify some possible allergies and can find some relief for your symptoms. We're going to start with the most common allergies, seasonal, also known as hay fever or allergic rhinitis. These are typically self-diagnosable and self-treatable. Most people who have these types of allergies are aware they have them because the symptoms tend to come on during certain times of the year or when the particular allergen is high. Although, if you have multiple allergies to things present longer than a season or a short cycle, it may be more difficult to pinpoint the specific allergen. This is when visiting an allergist could be a good idea. Seasonal allergies are to things like pollen, grasses, weeds, and mold. And symptoms are the typical itchy, watery eyes, congestion, scratchy throat, runny nose, sneezing, or coughing. And treatments can range from just trying to limit exposure to over-the-counter remedies or medications, and allergy drops or shots if you're trying to reduce your body's reaction to particular allergens. But what happens when you have other allergies? Everyone and every body is different. In theory, a person could be allergic to anything in their environment, but we're going to talk about three categories that I see most often in practice. These are dietary, environmental, and fragrance or chemicals. So let's start with diet, because anything you're putting in your body can have a huge effect if your body isn't reacting well to it. And for today's talk, we're focusing on food sensitivities, because a true food allergy would be the anaphylactic type of reaction. Chances are you already know if you have a food allergy, but food sensitivities can be much more difficult to identify. One of the most common food sensitivities I see is dairy. A dairy sensitivity or lactose intolerance can cause bloating, gas, and diarrhea. And while studies are mixed on whether dairy causes an increase in mucus or congestion, I have seen cases where after a client who has a dairy sensitivity cuts out all dairy, their sinuses are much clearer and their nasal breathing improves. If you've suffered from chronic sinus congestion or issues and haven't determined a cause, look at cutting out dairy for a few weeks and see if you notice a difference in how you feel. And keep in mind, dairy isn't just milk. It also includes yogurt, kefir. Whey protein can be an issue if it is a sensitivity to whey. Cheeses, sour cream, ice cream, cream-based sauces, and baked goods can have dairy in them too. Now let's talk about sugar. No natural sugars such as fruit. I'm talking about refined white sugar or similar products. Refined sugars can cause inflammation throughout the body. So if your sinuses are already inflamed and you're consuming even moderate amounts of sugar, this can definitely exacerbate the problem. And unfortunately, the standard American diet now often includes packaged and processed foods, and these often have high amounts of sugar in them. If you suffer from chronic pain, inflammation, or inflammatory medical issues, look at your diet. See if you can cut out processed foods and transition to a diet of whole, real foods. These would be things like meats, vegetables, fruits, and whole grains. And speaking of diets, histamine intolerance is something that people are rarely aware of, but it can have a huge impact on the body. So I just want to touch on this today, because if you have histamine receptors throughout your body, histamine intolerance can affect several body systems. In a small 2019 study, participants experienced an average of 11 symptoms, with 96.8% experiencing more than 3 symptoms. Histamine intolerant symptoms are nonspecific. That means they can appear like symptoms of other conditions, and this can often make it challenging for doctors to diagnose. Gastrointestinal symptoms are the most common. They include digestive issues, abdominal pain, bloating, diarrhea, constipation, gas, nausea, or vomiting. And while they may vary, other common reactions associated with histamine intolerance include headaches or migraines, nasal congestion or sinus issues, fatigue, itchy skin, hives, or irregular menstrual cycles. In more severe cases, histamine intolerance can cause abdominal cramping, tissue swelling, high blood pressure, irregular heart rate, anxiety, difficulty regulating body temperature, and dizziness. So if you can identify with multiple symptoms on this page, I would encourage you to learn more about histamine intolerance and discuss it with your doctor. So what causes histamine intolerance? You naturally produce histamine along with the enzyme diamine oxidase. DAO is responsible for breaking down histamine that you take in from foods. If you develop a DAO deficiency and can't break down histamine, you could develop histamine intolerance. Things that can affect your DAO enzyme or histamine levels include your genetics. You may have a mutation in the gene that causes your body to produce DAO. Medications. Some medications can temporarily block DAO functions or prevent production, and these would include phlegm reducers, antiemetics, antiarrhythmics, blood pressure medications, and antidepressants. Gastrointestinal disorders like inflammatory bowel disease, IBD, can cause DAO deficiency. Diets rich in histamine foods can cause DAO enzymes to function improperly. Some foods can block DAO enzymes or trigger histamine release. And bacterial overgrowth. When you don't digest food properly, bacteria grow, causing you to produce too much histamine. Typical DAO enzyme levels can't break down the increased histamine in your body, and this causes a reaction. So let's take a look at this list of high histamine foods. As you can see, there are many foods that either contain high levels of histamine or they trigger your body to produce more histamine. And obviously, if bacterial overgrowth is the cause for you, anything that feeds those bacteria, in theory, could lead to more histamine and an inability to manage it. So if you suspect that you may have histamine intolerance, talk to your doctor, nutritionist, or dietitian to make a plan to do an elimination diet safely. Okay, let's jump into environmental allergies, because there are so many things that we're exposed to every day in our homes, schools, offices, and environment. Environmental allergies include dust, dust mites, pet dander or hair, pollen, cockroaches, and mold. There are other things too, but these are the most common. And you'll notice that these environmental allergens cross over with seasonal allergens. Many people know they're allergic to things in the outside environment, but they fail to look closely at their homes and workspaces. Take a look at the areas where you spend your most time and see if there may be allergens present that have been previously ignored. Mold exposure and mold toxicity are really deep topics. We aren't going to dig into all of it today, but I want you to be aware of any possible mold in your home. The following locations are common areas for mold: Walk through your home and check these areas. If you suspect mold, it is important to get it tested and treated correctly. So basements and crawl spaces, poorly ventilated rooms, especially those with moisture, such as bathrooms, areas around leaky windows and doors, roof leaks, so attics, inside ceilings and walls with water damage, behind appliances where condensation happens, or underneath appliances that have leaked in the past. So check your dishwasher, your clothes washer, and refrigerator lines for possible leaks. And keep in mind that water damaged areas can begin to grow mold in as little as 24 hours after water exposure. So if you had an area that was not completely dried out within 24 hours, you'll want to carefully inspect those areas. As you can see, this list of mold allergy symptoms on the left is pretty standard: sneezing, runny nose, coughing, itchy eyes. But the mold toxicity symptoms on the right go way beyond typical allergy symptoms. This is when someone may start having cognitive issues, full body symptoms such as pain or chronic fatigue, vestibular system issues such as dizziness or tinnitus, and even changes in mood or symptoms that resemble hormonal imbalance. If you have unexplained allergic or toxicity symptoms, explore the possibility of mold exposure. Let's talk about what you can do to limit or minimize allergens at home, specifically in the bedroom, because we spend many hours in our bedrooms, and this is where we want to be breathing well so we can be sleeping well. So number one, wash all your bedding 1 time a week. Consider using a clean pillowcase nightly if you are susceptible to allergies. Wash or vacuum all soft toys or fabrics in the room, and this would include things like stuffed animals and throw blankets. Shower at night before bed. Our hair and our skin can collect potential allergens throughout the day. Wear clean pajamas. Pull the bed away from the wall. Vacuum the entire room, including under the bed, the headboard, and the baseboards. Dust any shelving and any items stored in the room. And remove any unnecessary items that collect dust or dander. Clean all windows, drapes, blinds, and curtains using the recommended methods. Remove any unnecessary fabrics from the room. Consider using a room air purifier with a HEPA filter. Change your whole house filter at least every 3 months, and consider upgrading to a higher grade filter that will catch smaller size particles. And don't leave wet or sweaty clothes in the hamper. This can breed mold. Okay, our last category today is chemicals and fragrances. This is another often overlooked category of allergens that we are all exposed to daily. So much of our lives include manufactured items, things that aren't natural or from nature. We live in homes built out of products that include many different chemicals. Our day-to-day lives are filled with fragrance, and not naturally derived fragrances from plants, but chemicals designed to overwhelm our senses. Look at this page and then look around your house to identify the products that you use daily that contain fragrances. Fragrances are usually easy to identify, as most products clearly list fragrance, perfume, or parfum in the ingredient list. The products you use daily are the ones to consider replacing first, especially anything that touches your body, including the obvious perfumes or colognes, but also other body care products like soap, deodorant, lotions, shampoo and conditioner, makeup and cosmetics, and your detergent. The items you're exposed to on a constant or regular basis can have a huge effect on how you feel. Fragrance means a blend of ingredients. So when you see fragrance listed on an ingredient list, it doesn't mean one type of fragrance. This fragrance label can include any number of nearly 4,000 chemicals. And because of a loophole in the Federal Fair Packaging and Labeling Act of 1973, companies do not have to list the ingredients in their quote-unquote fragrance, as it can be considered proprietary information. One group of chemicals that may be included in fragrance blends are phthalates. These chemicals are known endocrine disruptors, meaning they can disrupt hormone activity, reduce sperm counts, and may cause reproductive malformations. So if you're looking to become pregnant, this is definitely something you want to pay attention to. Many medical and reproductive clinics now have fragrance-free office policies because they know how fragrances can negatively impact the body by disrupting the endocrine system. Let's touch on fragrance-free versus unscented products because it seems like they would be similar, but there's actually a huge difference. Fragrance-free means that the product contains no added fragrance. Unscented products often contain chemicals to neutralize or mask any odors from other ingredients. So choose fragrance-free whenever possible. Unscented products can have just as many or more chemicals than traditional scented products. Because replacing products can get really expensive, consider not replacing everything at once, but slowly replacing items with fragrance-free alternatives as you run out of what you're already using. For more information on safer choices and alternatives to your personal care products, visit the Environmental Working Group at ewg.org/skindeep. The good news is that when allergies are treated, it can lead to many benefits, including reduced congestion, improved nasal breathing, reduced inflammation, improved sleep, increased energy, a strengthened immune system, and fewer infections. Thank you so much for listening today. I hope you learned something, and if you struggle with symptoms of allergies, I hope I've given you some helpful tips to reduce or eliminate them. The world of allergies is vast, so if you have more questions, I'd encourage you to find a trusted allergist that can help you identify and treat your particular allergies. Be well.